don't be shy on taking different opportunities, right? If there's opportunity for you to present a poster, just because you never done it before doesn't mean you shouldn't, right? Do work, right? It's okay to do something different. If someone hasn't done it, get guidance along the way, right? Identify a mentorship within your program because it does help your experience. I know for myself, I've had professors like Dr. Lassiter, I've had professors like Dr. Valera, professors like Dr. Brown. I could keep going on, but even having like a supported dean, our dean was very hands on with us and not just being afraid of people or having conversations with them based off their title or you just putting your mind that, well, they're not available, right? You're in these spaces for a reason. And if you want to make an impactful difference, take pride in having a seat at the table, right? Take pride in getting the education and the tools to help you navigate a lot of these spaces that some of us are not familiar with, right?
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Kimberly Pierre. Kimberly is a dedicated, multi-dimensional public health professional working in several roles. She is the Deputy Director of the Department of Health and Senior Services at the Township of Irvington, an adjunct professor at Montclair State University, and an associate director of health communications at the Substance and Sexual Health Lab, or the SASH Lab, housed at the Yale School of Public Health, as well as being a public health consultant. She is driven by an unwavering dedication to improving health disparity prevention and addressing the unique needs of communities. She conferred a Bachelor of Science in Public Health, Community Health Education at Montclair State University, and her Master of Public Health in Urban Public Health at Rutgers School of Public Health. In today's episode, you'll hear and learn more about how non-traditional paths in public health can lead to fulfilling careers, why hands-on experiences are vital for understanding community health and impacting public health, her perspective on why quality of work matters more than the titles in public health roles, and the importance of taking pride in having a seat at the table and making an impact with that seat that you have there, and much, much more. Be sure to hit that subscribe button if you have not yet, and enjoy today's episode.
Hey, my name is Kimberly Pierre. I'm a public health practitioner, educator, and a community advocate, and you are tuned into Public Health Careers.
Kimberly, welcome to the show. Very happy to have you on.
Thanks for having me. Happy to be here.
It is my pleasure. I know that we have connected on, I don't know, LinkedIn, Instagram at APHA, so it's just really good to have you on and hear more about your story.
Well, I'm happy to share, and I'm just, grateful for the opportunity, right? So thank you for that. And thank you for having this space and this platform to do just that. I think that's really helpful for those who are coming up, maybe even in the field, but gives us something to connect with. So thanks.
Yeah, my pleasure. And thank you for taking the time for being a part of that and sharing your story and sharing advice and insights into that. So, jumping into things, how do you identify and tell us a little about your personal background?
So my pronouns are she, her, and hers. My background, I'm of Haitian descent, so I'm Haitian American. I'm New Jersey native, and I am a first gen proud Black woman.
Well, I love to hear that. And shout out to the zoos out there for my Haitians out there. But definitely appreciate that. And I think it's so important that we like just show up as ourselves in all our identities and all our ways. And I think that is something that's so true in public health. And just to shift a little bit again, so I know that you have been an educator, a teacher, and a lot of some of the advice that you share with your students is around non-traditional approaches in public health. Can you talk more about that?
So for myself, I was one of those people who was introduced to public health um, just because. And what I mean by that is when I first went into college, I started as a biology major, and the track that I had was either become a nurse or a doctor, right? Or maybe let's even put in physician assistant. There was no talk, I should say, of prevention science or even public health. So it was completely new to me. It wasn't until I took my first chemistry class and I struggled so badly, right? I'm talking the class average in my course was like a 25 for within the first exam. And it was at that moment that I started to think like what else that I could do because outside of grades, right, I also want to be able to execute and have a basic understanding, which is when I took my first introduction to public health class. So when I took my first public health class, I was pretty much amazed on the science behind preventing people from getting sicker, the basic understanding of having information disseminated in a digestible way, right? Just understanding the science of readability, or just understanding that everyone has the same literacy levels. So how do we get a health message to them? And I found that to be very appealing. I also learned about different terms outside of terms that I learned when I was a biology major. And I think from there, I made the decision to want to take the course and see it through. And I'm glad I did because I am who I am today from that decision. So.
Shout out to you for jumping into that. And I think it's important just to highlight our journey many a times is in the direction of like medical school, nursing, physician assistant. And then as we learn more about how we can impact health and learn about the different ways and to your point, like the prevention aspect of it, then we're able to find public health or similar related type of work. But going back to like the non-traditional approaches, let's say there's a first year undergrad student that comes to you and is asking, hey, what is some like non-traditional advice that you would give me? What would you tell them?
So to start off, I would say try everything, right? Well, everything that's within your reach, I would say. Going for myself, I mentioned to you guys that mentioned to you, excuse me, that I was introduced to public health because I had difficulty with a course, and I just happened to try to, look into something else, and elective ended up turning to my new major. In me being in the public health discipline, I didn't just do like internships that were focused on health. I learned more about behavioral health and sciences, those who are on the spectrum, and I exposed myself to just different, I guess, career paths in helping people because helping people is relative, right? It's not just about the title you hold, but also how you are able to work with others and how you're able to give people that customer service experience when they have that engagement with you. So I would say just going back to my point, just trying different things, right? It's not always about, well, I want to get into the CDC because it's health, or it's not about, I'm going to go to my local hospital. But what about the grassroots organizations, right? The people who are boots on the ground. Just understanding what are the needs of the communities that you're looking to serve? What are their capacities, right? And seeing how you can um, be a person, or I guess like a channel to be able to execute ways to create advancements and accessibility to those that you're looking to serve.
Great advice. Great advice. I think there's so many ways that you can take the skill sets in public health and apply it. And I think something that I haven't really thought about, but what kind of came to my mind is like how grassroots organizations oftentimes are doing a lot of public health work, whether that's meeting the need of their community, understanding that need of the community, communicating that need of the community, or working to get prevention work. So just knowing that like you don't have to go to the CDC to do public health work. There's so many different ways to do that. And we'll get more into your journey and how you've gotten here. But you won the 2023 Health Educator of the Year award for the New Jersey Society for Public Health Education.
Yeah.
So first of all, congratulations.
Thank
Tell
you.
us, yeah, you're most welcome. So tell us about that journey, the work that you were involved in leading to that award.
So first, I just want to give a big shout out to New Jersey Society of Public Health Education. I am on their board as well as currently as the program committee chair. But at the time when I did receive the award last December, I was actually an elected position as secretary for the board. And for me to just receive the first, it was a shock to me. I just want to put it out there. But it was just I guess, a influx of submissions from people that I've worked with currently in the past that just kind of nominated me for the opportunity, which I'm very, very grateful for. To give a little bit more background about the actual award, so for the Health Educator of the Year award, it was pretty much established to members who've shown excellence in practice of health education, and they also have an active commitment to NJ Sophie. So as I mentioned, I was in an elected board position, but I'm very active in the communities that I serve. And I know we'll talk a little bit more about my titles and the work I do, but I really do believe in boots in the ground and meeting the people where they are and just honing in on that. Yeah, I hope that answers your question.
Yeah, yeah, it
Yeah.
absolutely does. And I think well, thank you for that word crucible. And many times we see people that win awards, and oftentimes it is just the perseverance of them consistently showing up and doing that work. And I'm glad that you were able to be recognized for that.
That's appreciated. I think in a lot of these spaces, you don't really do things for the acknowledgement, or at least for myself. It's not about how many people know who you are. It's really about the impact that you are doing. And I truly do believe in just the efforts I'm putting in and contributing for it to have sustainable efforts beyond me, right? People come and go, right? But the work is always needed to be done. And just being a part of that is very, very, very great. I feel very grateful for it.
Yeah, I appreciate that perspective, and I think many of us coming into this type of work, it is well, that is a perspective that we do take. Is like, well, maybe I don't know. They quiet a lot on that, but yeah, and I think that is a well-intentioned perspective because yeah, the work does continue, and regardless of if we get awards or not, we are here to do the work, and showing up to do the work is the work. So, shifting a little bit, what does public health mean to you?
Public health to me means access. Public health to me means, well, that's really the first thing, access. I gotta think about that. That's a good question. Public health to me, yeah, I would say public health to me really does mean access. It means equity. It means consideration, right? It means cultural competence. It's just a given right for all. When we think about health itself, this shouldn't be something that's questioned, right? Or you have to feel like you're living a life of scarcity to just be able to obtain. So I would say, just if I had to combine like a definition, just what I had just shared. So.
Appreciate that. And you alluded a little bit to this before. You got your bachelor's of science. Well, you got your bachelor's of science in public health and community health education at Montclair State University.
Yes.
You didn't start off with that pursuit, so maybe walk us through what was that path for you coming into to school, and more of that transformation of how did the public health elective kind of play into you shifting past and then going into the bachelor's of public health?
So when I first started my undergraduate studies, I went in as a biology major. I believe there was like a gateway program that I had got accepted into, and my aspirations was to become a medical doctor because I want to help all the sick people, right? I want to be able to be someone like I want to be a provider for those who look like me as well. Because a lot of times that I've noticed in my experience, it's not as often as you may have a provider that looks like you, and also that you feel like they care. And I think that sometimes our experiences are relative, but sometimes that dismissive feeling isn't the best. So, with that perspective, I'm like, I want to be a force to reckon with in the field of science until I took chemistry, right? I would like to just give a shout out to all my professors, but I guess a special shout out to Dr. Teddy because she was actually the person that introduced me to public health when I took my introduction course. And I feel like the way that just just the way that it was introduced to me, it just made sense.
That's
How do
fine.
I not want to, to myself, I was thinking, how do I not want to be in a profession that is working to help people to not get sicker? How can I not want to be in a profession that is understanding new trends and finding ways to have the communities that they serve understand, right? How do I not want to be in a profession that is open to innovation and finding different ways to and not necessarily reinvent the wheel, but modify just health practices in a way for people to be current with the times. And that introduction to that course really was life changing to me because, like you mentioned, it started as an elective, and then at that moment, I was like, this is where I have to be. So.
And one of the experiences you had during undergrad was as a community health educator at from the start. Tell us about that experience and maybe how that shaped some of the early health education work that Kimberly would come out to do?
So before I even talk about my experience working for that nonprofit, actually, I would say that in that shift in my major, I actually was introduced to what's called the Drop-In Center at Montclair State University, where they actually was like a peer-to-peer support group. And what I mean by support was that they shared different health messages, whether it's about body image, about prevention, when it comes to sexually transmitted diseases and infections, talk about nutrition education. And you got this hands-on experience on the campus to work with other students, educate them, and even have this space for them to come and learn. And then from there, I just had the opportunity during I would say my freshman year, going into my sophomore year, to work for the nonprofit from the start, which was a Title V funded program that was focused on prevention science, more so focused on like abstinence education, but going across the lifespan, understanding life choices and just decision making skills, which I thought that it just showed how health can relate in so many different channels, if that makes sense. If you're catching what I'm saying, but you touch the mind, right? What are your aspirations? What do you want to become, right? How do you see yourself, right? It also touched your body, right? Learning what are resources out there, right? What are the best practices for you to maybe prevent yourself from being exposed to different sexually transmitted infections, diseases. It introduced the topic of pregnancy, right? Understanding puberty, how your body functions, and just kind of go into just future planning, which I thought was such an innovative approach with the curriculum that we did use, where it kind of had the youth that we worked with, and to be specific, we worked with youth from fifth grade all the way up to 12th grade in different public and even private entities, and just changing or shifting the narrative when it comes to prevention and understanding health. So it was in addition to their health classes that was within alignment with their current New Jersey state standards for health education as well. So that was great, I would say. And then we
Uh,
just took it and ran with it, and then just kind of built from that. I just found different opportunities to work with different populations. So I mentioned when I was at Montclair, I was a part of the drop-in center. Then I started doing work with the Women's Health Center and exposing that to other opportunities and seeing what other local organizations was around my way and seeing how I could chip in and help too.
and why do you think that was important for you to work to get that experience and work with these different organizations at that point in time?
In the beginning of my interest in public health, I felt like it was so important because for me to be a part of the change, I need to understand what changes need to be made. And it's not me coming from an outside perspective, looking in, because I could think whatever, right? But if I'm going into a new territory, I'm going to a new space or a new community, they already have a basic understanding and idea of what might be helpful for them or what needs they would want to be addressed, and that baseline alone makes it easier to find ways to approach different prevention messages. So for me, it was important because it gave me an understanding, right? I didn't come in assuming because people are from said area. I didn't come in just with the assumption that, well, this is what's important based off of my own thoughts or my own biases that I might have had at the time. But instead, I felt like I was an open book and was more receptive to hearing and just taking things from there.
That's an important perspective, and I think being willing to realize that you're not the experts in the work and there's a lot of value in the lived experience and the experiences that people and organizations have is important as well. So did you have any like big undergrad takeaways that you wanted to share with us?
For undergraduate, I know I spoke earlier about taking non-traditional approaches. I know that I mentioned I was a part of the drop-in center, but other key takeaways that I just want to share that I notice or when I reflect now from my past during my undergraduate studies is the different activities I was in involvement with. And outside of the drop-in center, I was also part of the IT department. And I know this probably a little bit left, right? But to me, I'm going to say it's not because having a basic understanding on technology in general is beyond helpful, especially given this new AI period. But just having that instinct, that what is it? I don't want to say instant. You're gonna take all this out. But having the opportunity to serve in the capacity when it comes to computer needs and understanding like what are some things that kind of were troubling for different people, whether they were professors or students, it kind of put in my mind like, okay, we can find ways to make things easier for people, right? Something as simple as that. And I think that's when my public health hat started turning, right? Because you identify what the problem is, right? And then you try to find ways to address it. But you also find different ways to maximize on your strength. So the more I learned and was able to help others, it helped me. And it gave me this passion to also want to get into health communications, right? How do we communicate with the public in a way that they'll be receptive to it, right? Which opened the doors for me to have other opportunities, such as the opportunity when I was able to be a marketing consultant for innovation to impact at Yale, right? I kind of took what I learned, right, with the things I learned when it comes to community-based customer service appeal, and then trying to transfer it there, or even in my current role. I know I serve as a public health consultant, but in my role at Yale, I'm the associate director of health communication. So it's like it's even within the title, but you're trying to understand how to make things more mainstream, right? But that baseline was very, very helpful for myself. Another thing I want to add was that I ended up becoming a resident assistant, right? That's what you said.
All right, yeah.
Oh yeah, yeah. So I ended up becoming a resident assistant, and even in that space, because I actually started my undergraduate career as a commuter, and a lot of people have this misconception, like being a commuter, you're missing out, or because you're not standing. But I feel like you have to move with more intention, right? So for myself, I found different clubs to be a part of. I mentioned to you I was working in IT. I mentioned to you that I was a part of the drop-in center, but it also gave me opportunity to understand what the culture and the community of the school I was in was like, right? When you're creating these programs for your residents, right? What will be most appealing to them? What will be most beneficial? Flu season's around the corner. I know I have this passion for health, but how do we get people's buy-in to know to wash their hands or know to maybe get vaccinated if they still choose to, or get tested, right? What to identify? And it kind of just spiraled from there.
I'm grateful that you also added the part around the IT, which definitely isn't something like someone would traditionally think about. But there are so many ways that we gain skills and experiences from things that are not quote unquote ideal, but are still important to our journey. So I appreciate you sharing that. And after your undergrad, you went on to pursue an MPH in urban public health at Rutgers School of Public Health. So maybe tell us more about that process of thinking about going for a master's degree, and then more about like maybe the master's in public health specifically.
So for my own personal journey after undergrad, when I applied for master's programs, Rutgers actually wasn't one of the schools that accepted me right away. I've got accepted at schools like BU. I applied for like programs in Seton Hall. I even applied to local university, Kane, just to for those who maybe are Jersey based. But Rutgers didn't accept me for my MPH. Instead, I was given the opportunity to do a certificate program. And for those who probably ever received any denials, right? We'll just say that the door was just not open for you at that time, but I was so grateful for it because I did not really understand or know what I was setting myself up for. Like having a master's was like something I never even thought of, especially coming from a family where even having a high school diploma, let alone a bachelor's degree, wasn't something that I saw, and I had to navigate the spaces that I was in. And I'm just very grateful for different mentorship that I had that opened the door for me to even consider getting a master's. But going to Rutgers, I did the certificate program, and that actually gave me an idea to kind of take the basic core classes or fundamental classes for my master's. And then I was able to transition into my specific concentration, which is urban public health. And for anyone who's on this call or who's listening or even watching, sometimes we don't always go in a path or the direction that we feel like we will, right? It's like that we just want things to be a certain way, but it's okay when it's not, right? Because we end up getting more opportunities and more blessings in the process. And me getting my certificate, I was very active with my graduate studies. I ended up being the president of SGA. Didn't even know master's programs had those opportunities. I was really hands on. We had a program called Voices. So it's basically a program for volunteering. And I was introduced to maternal and child health in the capacity of Are You Match? I believe that was the program called, and I later ended up doing a fellowship. But from that certificate, I could have been upset or I could have been angry, like, I didn't get to the master's program, I'm not going to go. But instead, I took it for what it was and actually opened the door for other opportunities for me to pursue my study. And then I graduated. So, and I'm very grateful for that as well.
Shout out to you and appreciate the vulnerability in this story. And yeah, because not every door is going to open the way that you think it's going to open. And it is about persevering and continuing to build on those lessons and continuing to just, choose you in whatever that journey looks like. So I'm glad that you were able to do that. And I guess that's also a shout out to like using certificates as a way to get into Masters of Public Health program, because I definitely have heard that before. So I think I could research more into that. But and I think it is also because a master's program in itself is a big investment. So maybe even just thinking about, okay, I could do this certificate is going to help me be more competitive, and then if I do want to transition full time, then I can do that. But I appreciate those insights.
Well, thank you for the question. Please give me more.
Well, I definitely have a couple more to ask, so we can do that. So while you're in your MPH program, you spoke about some of the positions that you had. I will list a couple of them here. I'm sure that there are more. Please feel free to talk about the ones that were maybe most impactful, or what were the things that you took away from them, or what did you do in those roles. So during your MPH, you were a Best Maternal Child Health Fellow, an Essex PASIAC Wellness Coalition Program Assistant at Rutgers, New Jersey Medical School, a Title V Maternal Child Health Intern at Healthy Women, Healthy Families at New Jersey Department of Health, a Lead Research Assistant at Rutgers School of Public Health. And there might be some more, but I will pause there. I will let you talk about some of those experiences. Love to hear more.
Yeah, so I'm one of those people that I stay busy, right? But in a good way, right? So during my studies, I was still working at the nonprofit, at the local nonprofit we mentioned before I transitioned to another, doing the same health message. But at Rutgers, I was actually working for Essex Passaic Wellness Coalition, which is basically focused on cancer prevention, which was a very unique experience because cancer disparities was never something that I thought of, um, let alone like maternal child health, which is something that I'm also passionate about, but I'll discuss further. So, to explain a little bit more about my time at the Essex Passaic Wellness Coalition, the whole focus or the mission of this coalition was to reduce the burden and even the incidence of cancer and chronic diseases within Essex and Passaic County in New Jersey, by way of doing outreach, education, making screenings more accessible, and having more access to treatments and even follow up. So when in my role as program assistant there, I worked very closely with the PI and the director of the organization. And we involved ourselves in a lot of outreach within Essex and Passaic County, whether it be health fairs, whether it be webinars, whether it be things going on in the local hospitals and just being hands on, handing out literature, just explaining to people what cancer disparities may look like. And it was a very fulfilling opportunity because I myself didn't even know about how cancer disparities are impacting the lives of people or how things could be prevented, even with this mindset of, well, if it's hereditary, that's your end all be all. So it was a great opportunity, and I'm really grateful for Rutgers for allowing me the space to be able to work with the coalition group. You mentioned the best fellowship. So in that, I had the opportunity to work with actually University Hospital, Dr. Roche, Dr. Donnelly Campbell, and in that, I know I focused on a food insecurity amongst urban mothers, which was something that you would think will get more, I guess, shine over. But the disconnect is that there's this misconception that if someone's under, let's say, WIC or some type of assistance when it comes to the nutritional intake, that's enough. But they miss the aspect of understanding that there's a science to understanding food. If I may have access to food stamps, maybe my first thought isn't buying healthier foods because maybe I don't know how to use or how to cook them or how to apply it in my daily diet. Maybe there's a disconnect with my culture. So it's a little bit different to incorporate what's being um, explained to me and expressed on how to have a healthy pregnancy. So within my fellowship and working with those two site preceptors, I was able to kind of be hands-on with creating this innovative approach in having women who are coming in, who are going for their screenings, to come in and get a little bit more education, understanding about gestational diabetes, understanding that, hey, did you know that there is a dietitian in your local ShopRite or local grocery store? You can take advantage of this, right? How to walk the aisles of a grocery store, right? Showing them in real time how to cook the food because we had opportunities to have chefs to come in. And that was also fulfilling because during the most sacred time of people's lives, which is bringing in new life, sometimes you have a lot of uncertainty and you're not too sure and you want to be the best mother you can be. You want to be your healthiest for your child and you want your child to be as healthy. But the way that the information was broken down and just ex- um, just express to the patients who were a part of that, you can tell that it left lasting, like a lasting impression on them. To the point it's like, hey, my cousin's going to have a child. Can she come? Right? Can she be a part of this group? Right? It's something that you want to be a part of, not necessarily a chore. Right. And it didn't hurt that they were getting incentivized as well for some of the activities we have for them. For example, reading their receipt. Right? Can you go to the hospital just purchase being more intentional purchasing healthier food, and let's go through it, let's talk through it and taking it from there. So that was a very good experience and it continued to spark, right, my interest in maternal child health. Later on, as you mentioned, I did do the Title V internship, or I should say fellowship, with the state, where I was a part of the Healthy Women's Healthy Family Initiative, or Nurture NJ, for those who are familiar with New Jersey and some of the different opportunities we have, but just touching on doula care. Now, prior to that, I didn't even know what a doula was, right? But I was introduced to midwifery because actually my first publication during my senior year in undergraduate was about traditional birth attendants, which kind of sparked the understanding of midwifery, and kind of just had me more like intrigued that support actually makes an impact when it comes to people's health, right? Whether it's you're at the doctor getting your hand held to get your shot, right? Or maybe just someone taking their time to answer your question. So you don't feel that you're alone and giving you that space. But to go back to the fellowship, it was a great opportunity to learn about the state and how they function, see the opportunities and the partnerships that they did have when it came to doula care, how they were very intentional of having doulas having the seat at the table, and just the connections I was able to make during my time at the state. I had the opportunity to have my site preceptor, Lolitha Johnson, and former Assistant Commissioner Lisa Sare, who was I worked under her department when I was at the state. But it just kind of made you understand how we all work together, right? Health and the understanding of providing services is all interconnected, and you do need to know what services are out there to be able to make your best informed decisions for yourself, whether it's understanding SNAP, whether it's understanding that having social support can improve your outcomes when it comes to you being a birthing person, whether it be just having access, right, Medicaid reimbursement, having access to a breast pump through insurance, right? Sometimes people don't even know what they have access to, right? So those are really great opportunities that I can share a little bit
Yeah, you were definitely keeping yourself busy, that's for sure.
about. Yes, I won't add on more, but we were definitely very busy, but definitely grateful for it.
Yeah, no need to add on more. But if anyone is interested in learning more about your journey, like definitely reach out to Kimberly and connect and ask all the further questions that I do not have time to ask today. But kind of I want to kind of couple, I guess, two questions here. Like,
Yes.
what were some MPH takeaways, as well as how important were those various experiences that you had to, I guess, developing your skill set as a public health practitioner?
I would say don't run away from numbers and I'm saying this for anyone who's ever taken biostats, right? Was not my favorite, right? But just having the basic understanding of not only qualitative but quantitative data as well is very helpful, because when you can understand how trends work, or if you're trying to have justification to the need of certain things, especially for myself, I do community work, so needs assessments are very helpful for understanding the capacity or seeing what needs to be done or the limitations that we can address. But I would say definitely don't shy away from courses if they may seem difficult. Be open to asking questions. I think it's this notion or this culture that when you get to graduate school, you're just kind of thrown in and you have to figure it out. But there are resources available. I went to a university where we're keeping the public in public health, right? And I love the slogan because the public starts with us too, right? We are bringing in what we see the needs of our own communities are, which is why we're going into a profession that's moving with intention to address them, right? And just understanding that. I would say another takeaway from my master's studies is don't be shy on taking different opportunities, right? If there's opportunity for you to present a poster, just because you've never done it before doesn't mean you shouldn't, right? Do work, right? It's okay to do something different. If someone hasn't done it, get guidance along the way, right? Identify mentorship within your program because it does help your experience. I know for myself, I've had professors like Dr. Lassiter, I've had professors like Dr. Valera. I had professors like Dr. Brown. I could keep going on and on, but even having like a supported dean, our dean was very hands-on with us, and not just being afraid of people or having conversations with them based off their title, or you just putting your mind up. Well, they're not available, right? You're in these spaces for a reason, and if you want to make an impactful difference, take pride in having a seat at the table, right? Take pride in getting the education and the tools to help you navigate a lot of these spaces that some of us are not familiar with, right? Being at a university where the first gen was celebrated, right? In a sense of, when I was an undergraduate, I never even heard of that term till I got to my master's studies, and knowing that there's a community of people who resonate with you. And it doesn't mean that you're limited, but you can do so much, right? But it's about what you're willing to put forth the effort and connecting with your peers, right? You meet a lot of people and you never know who they'll become, and just taking advantage of just making genuine relationships and seeing them through.
Absolutely, absolutely resonate with that, and appreciate you for sharing that. And then, can you tell us about that transition out of your master's program into the workforce?
So my transition out, so I was actually working in a nonprofit. The nonprofit I worked for was called Not From the Start, because I transitioned from that to the New Jersey Physician Advisory Group. And in that, it had the same message of prevention, working with youth from fifth grade to 12th with the same type of curriculum. Just being intentional with just applying health behaviors and understanding of it across the trajectory of their lifespan, by having them start thinking with intention when it comes to their health and health practices. But I also concurrently also was a public health consultant, which I did have the role of the outreach manager at the SASH lab, which is the Substance and Sexual Health Lab at Yale. Before we were transferred to Yale, we were actually at Stony Brook University at the inception of the lab. So I was doing those two roles concurrently, with the focus of outreach and just working specifically with the SASH lab when it comes to sexual and substance use prevention. And when it came to New Jersey Physician Advisory Group, it was more so focusing on sexual health, pregnancy, understanding teen pregnancy, and along that umbrella. Um, when I was in those spaces, I kind of wanted a little bit more. And what I mean by that is like, I'm playing the role as a senior educator, right? We have junior staff under us. We're being intentional with understanding how to deliver messages. And in the space I was actually in, I was the only person with a public health background. So I worked alongside people who probably were educators before, going into social work, people who are hands-on in their own communities, just helping. Maybe they're the big bro or the big sister, but that just wanted to see youth do well. But I felt like I just wanted my skills to kind of touch more than just the school districts, right? And I want to touch more communities, as I was doing in my role at the SASH Lab, which was specific to some of the different communities or the cities we were working for, or working in, I should say. So then I then transitioned to working for local government, and I worked for a local municipality, which I still serve now. And I did outreach. Community outreach was my focus. As we know, when COVID first came, there was so much uncertainty. There was concerns when it came to where to get vaccinated, right? Understanding the vaccine, what is it doing to my body, understanding other prevention message. And in that role, when I worked in the health department, was that being intentional with creating programs. One of my first and most successful events that I was so proud of was we did for World AIDS Day. In conjunction with providing on site HIV testing and screenings, we also had vaccines available for COVID-19. When we understand that comorbidities impact our health, right? We just want to create a space under the administration I serve to provide people the resources so they can make more informed decisions and also making it easier. Why travel to maybe a hospital 30 minutes away or maybe make an appointment at your physician, which is not a problem, but we're bringing it to you, right? So we had mobile clinics. We did needs assessments, which I was very hands-on. I mentioned that's something that was very beneficial in my studies, but I actually got to implement it and just take it from there.
That's awesome. And one thing that's kind of coming up for me is like you're speaking about these different places where you're able to apply your public health skill set,
Mhm.
and more so than like applying it, like how did you even like get involved with SASH Lab and then NG Physician Advisory Group and then transitioning and doing work for a town and like how did all of that kind of happen?
So I want to start off with the premise of relationships matter. So just going back to when I mentioned my first publication was on traditional birth attendants, I want to give a shout out to my one of my mentors and actually one of my professors, Dr. Muta, which gave me the opportunity to be a part of a research team, which is when I had the opportunity to meet Dr. Apara, and we got to work closely on this initiative. And then from there, when she was, starting her own lab, I had the opportunity to apply, and was pretty much with the lab during its inception. And I haven't left, right? And I'm very grateful because you don't know who you'll meet along the way, but you might find people that you resonate with. I know that for a lot of the mentors that I do have, it's like you see them doing the work and it's like, how do I do that? How can I be in these spaces, right? I mentioned earlier that Dr. Teddy was my first public health professor. I had the opportunity to work with her Heart Smarts program, that's a part of New York Presbyterian Hospital, just changing the narrative when it comes to plant-based living, right? Being active, getting your steps in, and just cultivating that in the faith-based and local communities, like normalizing that conversation that, hey, it's okay to change your diet. Not everything has to be what you thought it was. It's okay to introduce new things to you. Going back to relationships, I mentioned that I had the opportunity to apply for the SASH lab when it was at Stony Brook, and just finding different ways to engage the community because outreach was my focus, right? How do we get the lab's mission out there? How do we get community buy-in? We do a lot of qualitative studies that I take pride in, giving a voice to the community, right? A lot of times when we're in these spaces, sometimes the people we serve may feel voiceless. Like, what's the point? This was a completely different experience with the SASH Lab because you're using their voices to be able to make impactful differences, right? Making adaptations to different interventions, giving youth their voice, right? To let them be a part of making a change when it comes to intervention creation and so on and so forth. And now at this time, I've transitioned from being the outreach manager to the associate director of outreach to now the associate director of health communication. And that is a role that I'm very, very proud of. And I'm grateful for it as well. So shout out to Dr. Apara.
And congratulations to you on that work and really growing yourself in the role as well.
Yes, yes. And then I guess to go into local government, just applying, right? I actually applied to a different role and for a whole different organization. And because I am Haitian American, I was actually told you should probably apply to Irvington because that's where I currently serve. because there's a high population of Haitian speaking people or residents, and it could be beneficial. And I applied and I got the position, and now I currently serve as the Deputy Director of Health and Senior Services. So it's very grateful to kind of see that the work you're doing is not going in vain. And it's okay to stay busy in a sense of that you're in alignment. I think even in as I'm speaking to you, it could be this assumption that maybe she's doing a lot at once, but everything ties into each other, right? In some way, shape, or form. Whether it's helping me improve my skill set or finding different ways to execute in a way that is quality over quantity. And I think that in all the residents or the communities I serve, that's ultimately what matters the most. So.
Appreciate you sharing that. And I don't think you mentioned it, but throughout some part of this journey at that time, you also have done like consulting. So tell
Mhm.
us more about how you maybe decided to get into doing consulting work and what does that look like for you?
When it comes to public health consulting, I think there's this misconception that it's very time consuming, right? You can't do other things. I think it's just about what you sign up for. Like currently, I'm on maybe about two projects right now. And with good time management, and if this is something a part of your area of expertise, it shouldn't necessarily feel like you're, I guess, ripping your hair out, like struggling to do the work, but instead just applying your skill base on like meaningful work. So I hope that answers your question, but it's just opening up and just broadening your horizons and just finding other ways to increase your impact, especially if you're interested in creating sustainable effort.
Yeah, and I think it's also very important to be intentional if you're getting into consulting in knowing like what you want to sign up for and
Yeah.
what that task actually requires of you and if you're able to do that because yes it can get very overwhelming very quickly if you don't prioritize and be intentional in doing that, so I appreciate that part of what you're sharing as well.
Absolutely. Thank you for the question.
Yeah, still got a couple more. Um, so you have a few different current roles. You've mentioned a couple of them already. But you are a research associate, no, a senior research associate at Market Consulting and Evaluation Services. You are also, as you said, you recently became deputy director of the Department of Health and Senior Services. And I feel like I missed it. So you are working at Yale
Yes.
in the capacity as well as an associate director of community outreach, now associate director of health communications.
Yes.
So tell us about those roles, maybe a little bit more about what you do in them.
All right, so to start, I guess I'll start with the marketing consulting. So that is an example of me doing public health consulting. So my current project right now is focusing on um, health disparities when it comes to African American women and how to basically address it. To not give too many details, but working closely with the state of New Jersey on addressing these health disparities and create key recommendation and policy recommendations as to what can the future look like in addressing some preventable diseases and preventable outcomes as well. So that is by way of consulting hours. And for those who are interested in consulting, that is a public health firm that, of course, you can apply. And if there's projects that are appealing to you, not every project is a long standing. Some could be 3 months, some could be 6, some could be 9 months, a year, or what have you. But you have the opportunity to sign up to projects that work alongside your schedule. So there's that. I've had done other projects such as working with the state of Massachusetts on abortion access or just having access to women health care, if that makes sense. I don't think that's what's called that.
Women's health.
Yeah, I'm gonna say that again. I you're gonna know it's that. But so other projects that I had worked on with the Amaka Consulting included working with Planned Parenthood of Massachusetts, where one of our focuses were abortion access, which is during right before the time of Roe versus Wade being overturned. So that was a very interesting climate to be a part of. But essentially the main focus is having access to women health services, which is a very fulfilling project to be a part of with Planned Parenthood. So that's just give an idea of some of the projects I worked on with them. In my role as Associate Director of Health Communication, I do serve as a public health consultant for the lab. And my main focus is just focusing on getting the work that our lab is doing out in real time, right? Having digestible messages of health prevention. We're always working, right? We have different publications coming up. We're doing work. Most recently, we have a DP1 grant where we're focusing on AI and having a lot of our youth that are part of that. I myself, I was over one of the studies called the Strong African American Family Studies, where we're focusing on creating an adaptation of an intervention and just seeing it through and actually actually implement it, excuse me, with different Black families when it comes to substance use prevention. We have the Dreamer Girl Project, which I'm currently lead, which is focusing on just empowering Black girls when it comes to their sexual health and substance use prevention. We're currently getting ready to conduct our final focus groups and seeing that project. So we have the Patterson Prevention Project. I want to give a shout out to our deputy director, Ms. Betty, who pretty much is over operations, but takes lead on the Patterson Prevention Project that we have. And just shout out to all our community partners that we work with in East Orange, Irvington, um, Patterson, and just in the local area and beyond. Because without the community, we're not able to do the work. But it gives the baseline to work with when we understand the needs of the community when they let us know. They let us into their space, and then we're able to execute. I also want to give a shout out to Christina. We also have, she's the Associate Director of Mental Health Initiatives, where we do Mental Health Mondays, where we're normalizing a conversation when it comes to mental health disparities, because there has been seen a correlation between mental health and substance use, right? What about if we meet the needs of their children and their families together in a safe space and just talking about these different topics and having people be more choosy of their choices? I want to give a shout out to Dr. Sitar as well, who is our statistician, right? So we have a little bit of everything at our lab, and the lab is always growing, right? With our new research assistants, our postdocs that are coming in, but essentially those who are interested in doing the work of prevention when it comes to sexual health and substance use. So that's to give you a little background what we do there. In my role as Deputy Director of Health and Senior Services, so um, I am currently in the position of administrator, but I'm very hands-on with just being in the community. Some of the initiatives that we have now, we have partnered with Birth Justice out of Ancient Song, for example, doing a bi-weekly supply and diaper, baby supply and diaper giveaway, and giving education alongside just to make it more accessible for people to know what local resources are. We work with our neighborhood and improvement corporation, where we are finding ways to just ensuring people know that they can be fed. In that department, they're giving out lunch and dinner to the people, to people in the community. We have a local food bank giving them out food, right? Because during the times of the holiday season, not everyone has the means to be able to um, just just go and splurge and buy food, but at least we're working to meet their basic necessities when they have children, doing just pop-up clinics. Most recently, we do on a quarterly basis mammogram mobile clinics, which have expanded to mammograms, pap smears, colorectal, and even a skincare mobile clinic, right? This misconception that if my skin is melanated, I can't have skin cancer. But that's beyond true, right? Just understanding that you can be at risk and this is how you can prevent yourself. Just finding innovative approaches to get health messages out. We had the township has an initiative for opioid right prevention. So it they took the novel approach of having like a concert, just drawing the people in with maybe some of their favorite celebrities, but having on site. Whether it's Narcan, education, connection to resources, whether it's rehabilitation, understanding that, hey, there are people out there looking to help you, whether it's counseling services, right? Because we mentioned earlier about mental health and so on and so forth. So those are some things that we do, and it doesn't even highlight what the township that I work for do, do to serve the local residents, but even our neighboring municipalities, right? I think collectively the goal is to meet the people where they are, and I've said that all throughout this interview, but the best way to do so is knowing how to work together as well, like knowing what resources are locally and just sharing the information as well.
Well, thank you for all the phenomenal work that you continue to lead. I think the question that I have and the listeners slash viewers probably have is, how does Kimberly fit in time to do all these things? How does Kimberly quote unquote balance or live the type of life that allows her to give and do these types of opportunities?
I would say just be intentional in learning what your why is. Everybody has their different reason why they're going into what are the fields they're going to, maybe the jobs that they go to. And I actually heard this from someone and it resonated with me. When you understand your why, it doesn't necessarily feel like work, right? My why is the passion that I have. I genuinely just want to be in the career path where I'm helping others. You can help people by whether it's your custodial or you work in maintenance. You can help somebody by picking up the phone as a receptionist, just giving them direction. But for me, because my passion is health, I want to be able to help as many people as I can, whether it's one person at a time, to know that they are given this right to be their most healthiest self. And we will create spaces where they know that there's accessibilities to have access to things to benefit their own health as well. And just knowing that your voice matters. I think that coming from just a household where, your parents don't necessarily, they're not native to the land. And, there's a disconnect with them not maybe speaking the native tongue. And sometimes the treatment is a little bit different. And just knowing that I come from this and this doesn't have to be people's experience. It doesn't have to be off putting. And people care no matter where you come from, no matter what you look like, right? We're here to serve. And ultimately, um, that's what really pushes me. I wake up bright and early every day. I still make time to go to the gym when I can, if I'm not too tired, right? But just starting off just on the right foot, just knowing I can help somebody, it truly just fuels me. And just knowing that I'm not alone, it's really about the teams that you're a part of, which is why it's never just about me or I, right? It's about we. Like we collectively can create such a greater impact if we can learn to work together and just be open and not just fearful or just maybe in our heads. Because I think a lot of times in our spaces, the idea of jealousy or people feel like you may have something that they don't might, take away from the work. But if we remove all that and seeing that if I'm playing to my strength and you're playing to your strength, that we're forced to be reckoned with because together we can really make an impact. I think that's something that I look forward to with the teams I'm a part of and in the spaces that I'm in and just the people that I meet with time. And hopefully they see the openness of wanting to help each other because it's not just about, hey, this is the role I have. Titles don't matter, right? You can lose them at any time. It's really about the work that you're doing and, you know, characters. Okay, check that out. I don't know. I was getting preachy, but
No,
no, but seriously, I really feel like you probably had slipped this up, but it's because I genuinely just want to do the work. Um, I don't care about the title. I don't care about that. I just care that every day I have the opportunity to help one person. And that's what fuels me. And I sleep great at night. 8 hours every night. Okay.
that's impressive. That's impressive. You got to lead a challenge at some point around that. Um, but thank you for taking the time and dedicating yourself to this work and continuing to show up in the work. And I guess where do you want to see yourself in the future?
I think that's a great question. If I had to think of my next steps in the future, I want to continue to work on the effort to create more sustainability. But I see myself, it may not happen, being more on the background and just creating more space for people behind me or who are currently with me to kind of, I guess, take space, right? There's more than enough room for all of us to make an impactful difference. And even if I have a platform to share with others to seeing the work being done, long term, I see myself still educating. One of the roles I do serve, I am a part-time professor at Montclair State University and just inspiring the future generation that they're more than capable and just knowing that they have resources and tools to use. So continue to being in that space, continue to work with local organizations who are doing the work, who are boots on the ground. Continue being a doula. I didn't really highlight that, but doula in the sense of supporting the families and the communities I serve, whether it's education or just having opportunities to be a part of live births. But just being there for others in a way that I would want to be done for myself. And I know that's relative because some of us can take or we can dish out sometimes more than we can take. But just treating people in a way that I feel like will be most beneficial for their advance.
Well, I look forward to seeing you make those strides and becoming that person that you envision in yourself and so much more.
Yes, yes. Thank you. That means a lot. So thank you.
Yeah, of course, and I truly mean it. So shifting you over to the last part of the show, the Furious Five, the 5 questions that I ask all guests.
Oh man, do I have answers? Let's see.
Yeah, absolutely do. Number one, what advice would you give to a student trying to pursue a career in public health?
You are making the best decision ever. My best advice is to see it through. Whether you do want to practice medicine or whether you want to be more hands-on and outreach, definitely having the basic understanding of the foundational principles of public health, it is very beneficial, and you will not regret your journey at all.
Number two, if you're talking to someone wanting to get into your position or your many positions, what advice would you give them?
Focus on the work, right? It's not about you doing things to get credit, but it's about the quality experiences you're doing for the communities or residents that you're serving for, and let your work speak for itself. And when the opportunity presents itself, I feel like you'll be more than capable of obtaining the titles that you may be looking for. But focus on the work.
Number three, what's something you're working on improving in your life right now?
What I'm working on is connecting more with others outside of just the circles that I'm in. So networking is your net worth, right? So for myself, I'm moving with intention on networking. So even for you guys seeing this call, let's connect, right? Because there's so much great work being done, and there's probably different ways that we can work collectively together. But right now, that is a project of mine to continue the work.
Number four, professionally, do you recommend anything?
Continue education, professional development, get certifications. If you're not sure about masters, it's okay to go for a certificate. For myself, that's helped me pursue my master's degree. You don't know what you don't know, and there's truly power in knowledge. So if you have the opportunity to, definitely be a forever student because there's always so much to learn.
And then, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
Great question. If I had to give myself one piece of advice is don't doubt yourself. I believe that a lot of times when you feel insecure or inferior to others because of where they are, you feel like you can't take up space or you can't do what they do. So just don't doubt yourself, and you're literally as good as the opportunities you put forth for yourself. So take chances, don't doubt yourself, and keep pushing.
Well, thank you, Kimberly, so much for this informative and fun conversation today. It was nice to connect and hear more about your journey because, as I said, we have been connected. We have chatted before, but I learned a lot about you today.
Awesome. Well, I thank you for the opportunity. And I just want to give you a shout out as well because you taking up this space, you creating this platform, you give people who probably wasn't even thinking about coming into health professions the opportunity to see that they can be here as well. And just your openness to like just hearing other people's stories. So I appreciate that as well. And thank you for the opportunity. If you haven't already, like, comment, and subscribe. He didn't tell me to say this, but I definitely think it's something that's great for you as well.
Well, I appreciate that a lot. Thank you so much. I will clip that up and put that somewhere for the good times, or maybe more so for the bad times. But as Kimberly said, thank you so much for watching or listening. Be sure to subscribe if you have not as yet. Leave a like, leave a review, share it with a friend. Greatly appreciate you all, and I'll see you all next week. Peace, everyone.